Guide to the graphic. Here we have a presentation of a cross-section that extends from the periosteum down to the pia mater, or the outer surface of the brain. In black is the periosteum, in green is the skull, in blue is the dura mater, in red is the arachnoid mater, the green hash mark is the subarachnoid space, and in orange is the pia mater, or the outer surface of the brain. Central nervous system infections. Central nervous system, or CNS infections, include a wide variety of clinical conditions and etiologies: meningitis, meningoencephalitis, encephalitis, brain and meningeal abscesses, and shunt infections. CNS infections are divided into two categories: septic and aseptic. Septic, or bacterial infections, are the result of hematogenous spread from a primary site of infection, parameningeal seeding from a localized infection, or trauma or congenital defects in the CNS. Aseptic infection is a term broadly used to describe chemical irritants, viral, fungal, parasitic, tuberculous, sarcoid, neoplastic, and syphilitic processes of the CNS. Pathophysiology. CNS infections may be caused by a variety of bacteria, fungi, viruses, and parasites. The most common causes of bacterial meningitis include Streptococcus pneumoniae, Haemophilus influenzae, and Neisseria meningitidis. The critical first step in the acquisition of acute bacterial meningitis is nasopharyngeal colonization by the bacterial pathogen. The bacteria must first attach themselves to nasopharyngeal epithelial cells. The bacteria are then phagocytized across non-ciliated columnar nasopharyngeal cells into the host bloodstream. A common characteristic of most CNS bacterial pathogens, for example, Haemophilus influenzae, Escherichia coli, and Neisseria meningitidis, is the presence of an extensive polysaccharide capsule that is resistant to neutrophil phagocytosis and complement opsonization. Bacteria replicate freely within the CSF until either bacterial overgrowth occurs or an effective antibiotic regimen is administered that terminates the process. Bacterial cell death then causes the release of cell wall components such as lipopolysaccharide, lipid A, lipoteichoic acid, teichoic acid, and peptidoglycan, depending on whether the pathogen is gram-positive or gram-negative. These cell wall components cause capillary endothelial cells and CNS macrophages to release cytokines, interleukin-1, and tumor necrosis factor, TNF. Capillary endothelial cells and CNS leukocytes release products of the cyclooxygenase arachidonic acid pathway, prostaglandins and thromboxanes, and platelet activating factor, PAF. PAF activates the coagulation cascade, and arachidonic acid metabolites stimulate vasodilation. These lead to cerebral edema, elevated intracranial pressure, CSF pleocytosis, disseminated intravascular coagulation, DIC, syndrome of inappropriate antidiuretic hormone secretion, SIADH, decreased cerebral blood flow, cerebral ischemia, and death. and that's central nervous system infections. Have a great day.